Right, so if you're getting persistent wrist pain and you've done all the treatment around the wrist, you can be doing stretching, strengthening, mobilization. You've seen physios, you've tried self-strengthening and nothing seems to be working. One of the big areas that are often missed is the forearm segment. Now, forearm, people will think about tennis elbows or golfer's elbows, but a lot of times the tightness is in the inner structures. These structures are located in between the radius and the ulna. Those are the two pieces of long bones in the forearm segment. Now, when the muscles and ligaments that's hidden on the inside part gets tight, the nerves, the blood vessels can get irritated. It can also get blocked in one way or the other, and that can mimic wrist pain. And it is literally just wrist, and people don't feel anything in the forearm. So it's really, really interesting. And one of the tests that we do is to palpate the forearm segment. And when you palpate, you really have to get really, really deep into it. So the technique is to really reinforce the thumb and really get deep into it. So you can press the innermost part of the forearm to see whether you can reproduce the symptoms. Now, in this case, the patient, when we're pressing, they can actually feel that radiation going straight to that wrist segment. And that is a strong indication that this is the area to release out. And when we're pressing, you can really feel the lumps and the knots that's often associated with long-term tightness. So one of the effective ways to release that out is to use a massage tool. In this case, this is just a stainless steel massage tool we use for the forearm and the hand segment. It's shaped and the size is the size of the forearm muscle. So it is very effective in achieving the depth and the amount of intensity that's required to get into the muscle. So you find that if you release and just massage on the surface, you're not even going to touch the skin of it. You really have to get into it and feel the little clicks and knots and massage each strand of the tissue out to get the intensity that's effective enough to resolve that wrist problem.